Sure. Okay, thank you, Tessie. So we'll start with our roll call. Catherine? Rhonda?
Here.
Doug?
Here.
Melissa?
Here.
Lisa?
Here.
Jennifer? Actually, it's Jennifer that I believe will not either be here or will be audio. Senator Yuko will not be here. Diane
Yes, here.
and Beverly. I see Catherine. Hi,
Hi.
Catherine. And an approval of the minutes from last meeting. Any approvals?
I'll move to approve the minutes.
Thank you.
And that was that you, Beverly?
Diane.
Okay.
Thank
I'll
you.
second. Lisa Brockman.
Thank you. Okay, let's get right in. I sent out the agenda, but I also sent out a task, kind of a breakdown of the task. And I had sent that out prior to our last meeting, but we never got to it because of our speakers, which was great. So we learned a lot from our three speakers. And we could probably spend 2 meetings talking about everything they went over. And we're at a point, I believe, that where time is of the essence, where we're running out of time and we've not accomplished a whole lot. And so in speaking with Catherine, I was not able to attend our overall committee meeting last week. And so I heard that the science committee may have broken task into dyad groups. And so I'm proposing that for us so that we can move forward, so that we can complete some of our different tasks and reach a point where we can make decisions and get our goals formulated. And does anyone have any questions about that? Do you agree? Do you have another path? Do you think something else might work?
You're going to split us into what?
Dyad groups, Doug. So we are permitted to work in groups of 2.
Okay. Well, here's my problem. My problem is that we have no support right now from the state. And the expectation is that there would be experts in whatever we're trying to come up with that would help to guide us in this process. And right now that contract has not been signed.
Well, I don't know how to answer that. Tessie, I don't know if you have an answer to that question.
But that's not, Tessie, that's not the point. The point is that we're talking about splitting up in dyads. I don't know what a dyad is, but the way it sounds like groups of two. And we're expected to split up in groups of two, and each group of two is expected to come back with some sort of written product for the next meeting. And I've been on a couple of these in the past, and generally we get staff help to come up with the ideas and then write them down and present them. Let us present them to the entire group. I just don't know, spending all that type of time in twos coming up with our own stuff that then we present to the committee is a great use of time.
So maybe we can simplify this a little bit. And I hear you, Doug. I hear what you're saying. And just to clarify, my experiences in the communities, and it is with working with providers and all of that. And so I have some information about a little bit, I guess a little information about all of these, but probably not enough to formulate true and objectionable opinions. But I feel that because time is of the essence, that anything that we do, anything that we produce is better than that. And right now we're at a stagnant. And so maybe it'll make more sense if I go through the handout that I passed out, or the forms I passed out that have the task that we are expected to fulfill, and along with what's educational to us, meaning there are tasks that was education and data gathering. For instance, training. What kind of training happens today? What's the availability of services today, so that we know how to enhance that training, so that we know how to enhance the availabilities. And so we obtained some information from our three speakers, probably not enough to make full and educated decisions, but I feel that we got enough to start us on something. And some things we may have to wait a little bit for added guidance and added direction from experts. But maybe if we go through this right now, and then we can talk about it and just see if it puts us maybe on a little bit of a clearer path. And so the first page, you'll see that what I did was I broke down the task specific to the experience committee. And I delineated it out into, okay, what's a true education we need to learn? And then what are our true actionable items? And so we have our task. One of our objectives is to look at the cost, availability of services in the home, community, and institutional care, training required for employees of institutional care, home care, hospice, first responders. Next is determination of the quality of services offered and the healthcare delivered. What are the tools? What are the resources? Next is determine evidence-based activities currently implemented and available to improve brain health. Identify safety needs and persons with Alzheimer's and dementias. Determine the legal issues that surround those with Alzheimer's and dementias. And then lastly, identify the process how the government determines the policies. So then the information that we need in order to make educated decisions are in the left-hand side under the title information. And so that is the type, cost, and availability, assisted living options, specific training requirements, and evaluate how government adopts. And then I X'd and highlighted those areas of education that or the areas that would provide us that education. So type, cost, and availability. Well, we need to find out the cost. Second, availability of services. that's education that we need. And so all those X's are relating to the education that we need in order to make an educated decision for the create action items. And then again, we go into that on the left where it says create action. One of the things we are to do is to look at quality care measures for the RCS. And Beverly, I think you even said there is none. There's none for RCS today. And then as a group, we decide, should there be? Should we look at quality measures for RCFs and propose those? And then what would those be? So for instance,
I forget the definition of an RCF. I know what it says. Does that include nursing homes?
No, it's the ALs,
Okay.
assisted livings. Am I right, Beverly? So those are the ALs.
She's not on. Is she on?
Yeah.
Yes. Okay.
Yes, RCFs are assisted living communities, nursing homes are separate.
Right. And today, skilled nursing facilities do have quality measures. And those are CMS driven, and it's based off of their staffing, it's based off of their assessments, and it's based off of their surveys that they have. But then it breaks down into quality standards. So for instance, a skilled nursing facility has a quality measure on falls with negative outcomes, bowel and bladder, how many incontinent residents they have. It goes through a series of clinical outcomes, so antipsychotic usage, and then there's several others. But then it also breaks down into how many discharges they have to the hospital, how many residents are discharged to home or to the community. And then it goes into staffing, how many RN hours, LPN hours, CNA hours, and then there's surveys. And it's much more broader than what I'm speaking to, but those are what their quality measures are. And that's for every skilled nursing facility in the nation. And that's not just a state thing, that's a CMS thing. So when we're looking at quality measures for the assisted livings, obviously we're looking at that in Ohio. Is that something in Ohio that we would like to propose? And then what would those measures be? So for instance, perhaps it could be the facility has a dedicated dementia Alzheimer's certified director. Maybe that's, and I'm just speaking in what ifs. Is that something we would view as important to have? Maybe a quality measure is how many of those residents that live in assisted livings, memory cares, have dedicated activities specifically for them, specifically for the stages of dementia.
Well,
go ahead.
I mean, the nursing home quality measures don't really reflect the experience of residents. So if we're talking about standards for memory care units or specialized care units, we would need to do that for nursing homes as well, because there are no quality measures about that. The only quality measure that really has an impact on people with dementia is antipsychotic use. And that's even very limited. There are only, there are a few diagnoses that are subtracted from that measure, schizophrenia, things where you would expect an antipsychotic medication, but it is not great. And so if we're talking about quality measures related to dementia care, we would need to do the same for licensed nursing homes in the state of Ohio as well.
I agree with you. And so my objective right now was I was just giving examples. But I totally agree with you. And so our job with that is to determine what are valid quality measurements that would help the community, help families, help a person who has a loved one at home that is thinking about institutional care. What public information would there be to help them in making that educated decision? And how do they determine what's the best of the best? Who has the best measurements? Does that make sense to everyone? So I guess whoever works on that portion would be looking at measurements that enhance the experience of the Alzheimer's and dementia resident. Measurements that are proven to be quality attributes of those providers.
I just don't feel like I'm qualified to do that.
Well, this is.
My mom
tell
died
you.
in
Yep.
an assisted living facility in August last year. And so I know the whole fact that we couldn't visit her regularly didn't help.
Sure.
The whole fact that she didn't have any people in the agency or in the facility that was talking to her on a regular basis. So she was by herself a lot. And so I know all that.
Sure.
But I'm not Bev Laubert. I can't go in and tell you what it's like to be somebody who visits those types of facilities on any given day. Even though I've supervised ombudsman in my time, so I just feel at a complete loss of being able to tell anybody what the quality measures are in this type of process.
So maybe if I understood where we might go with this, we would go through each of these tasks and identify, like, that would not be a task that Doug would raise his hand for.
Right, Doug, you wouldn't be on that committee or on that diet.
I'm not sure I'd be on any committees.
I don't know. I add, what should we have for skilled nursing? What should we have for assisted livings and memory cares? Is there anyone interested in diving into that? Okay, we're going to move on to the next one. Go ahead.
Well, I guess, so this is Lisa. Hi. So I know I sort of touched on this before. So I think a lot of these that we are talking about are focusing on RCFs and nursing homes. Did I miss somewhere where we were given the directive to focus on just that aspect of dementia care? I guess from my perspective, right, as the experience committee, the experience should be from the moment we start, a person in Ohio starts experiencing symptoms of Alzheimer's and related dementia. How supported are they? How supported is their caregiver? How well informed is their physician? How, what service available with the place where they're talking about long-term placement, right? So I feel like a lot of these focus on really good areas. Listen, that's the area where I work. So I agree that quality measures are necessary. And, there are things that are currently in place that don't make sense to hold, dementia-focused communities to, right? Unfortunately, as Nancy Reagan said, falls happen, right? So focusing on the number of falls is maybe not as important in our population as it is as are we keeping them safe if and when one happens, right? So I think there are lots of things that we can definitely focus on from those perspectives, but are we going to sort of start at the top of the whole experience that someone goes through, or are we just going to focus on the long-term care sort of perspective?
So my understanding is that it's all encompassing.
Okay.
All encompassing, correct? When I read about our duties, our task on the experience committee, you're right. It's about from the day it starts, those symptoms start, to taking it through to institutional care, but hopefully keeping them out of institutional care. But as I understand, part of our duties is to enhance their experience from the beginning to the end, and part of that is through the institutional care. Okay. And so I believe that this was added to ours, and this was on our task sheet in the beginning.
Right.
And so, yes, some of it is going to be directly related to the institutional care. Does that make sense for everyone?
It was item number 7. That's pulled directly from,
Right.
yeah.
This is Diane.
And so some of this, yeah,
Oh, just
Hi, Diane.
another quick question. So one of the things that, as I look through these, that doesn't
yes,
stand out that much to me is the home care aspect. Those people who
Well-
are, one, where are they being diagnosed, or are they being diagnosed from symptoms, right? We've talked in different meetings about physicians who are not giving diagnoses. Why aren't they? How can we help facilitate that, if that's possible? And then
No.
from there, where are they in home health care setting as their diseases advance, until they get to the point where they need institutional care? And then certainly, what's that process of coming up with what's best for them? So that's one thing that keeps tugging at me here. So I thought I'd throw that out there.
I so agree. And there is an aspect to that. The one test was availability of services in the home, community, and institutional care. And so I view that as that is home care. And that is a component that we do have to look at. And then part of our action is improving those services. See, I feel that the experience is big, right?
It's huge.
It's huge.
Right.
You could probably have 30 members just looking at the experience.
Yeah.
And I think we're hung up on the fact that there's 10 of us. And we have a lot of experiences that we have to figure out. But I'm there with you. And so one of us or two of us will have to focus on home care. We'll have to focus on the community services and determine, what is that today? What's that look like today? And I personally, I don't know that, but I will tell you this, is that when we have our narrative calls and our communication, and Tessie, I'm going to reach out to you this week about helping me set those up. And Melissa, you brought up last time about helping with some surveys, but I'm hoping that one of those groups can be home health providers. And so they can educate us and they can help us. And I think that in having those meetings or those calls with those provider groups and different groups, I think we'll get some of those answers. And our problem today is that, like Doug, I don't know every single one of these areas today. I don't know. I have an idea about all these areas today. But if someone asks me how the government evaluates and adopts policies, personally, that's not my dyad. I couldn't do that one.
Sure.
But I couldn't do legal protection. But I could probably look at quality measures. I could probably look at the services that are offered today in institutional settings. So I'm hoping that to get through our confusion, that if we just start somewhere with a couple of us, I'm going to focus on this, focus on that, we'll get our answers, and then probably decide we need additional help.
So what's the process beyond? So I'm sorry, I was on the phone when the meeting started. So beyond the dyads coming up with something, I don't know what format you want it in, then what happens after that?
Then I think that we take a couple weeks, we get into our group of 2, because we are permitted to work on things in groups of 2. We have a very focused area for the 2, and then at our next meeting, we're bringing that to it. This is what I found out. This is what we still need to do. Until we get to our point of making reasonable decisions, I view it as part of completion of objectives, getting us.
What's the format that you want for the input, the research? How do you want that coming back?
I would think that the 2 people working together would speak on that, that the two together would determine who is my best groups to speak to, who is my leader, who is my expert, reach out to that person to obtain, and then come up with, hey, this is what we found out.
Yeah, that's what I'm wondering this is what we found out. What if you can give us a template, a standard format to send it back in, so we're all looking at the same factors
yes,
on
I
the
can
topic.
do that. I will do that. I'll do that this week. But if we could just take a moment and walk through each one of these just to see where we all are on them. So the next one is improving quality of care received for all groups. So this is gonna have to be, what's gonna have to get looked at here is what kind of care is being received by home health, what kind is being received by hospice, by the first responders, by the institutions. So maybe this one, the answers for this one come out of those individual provider meetings and caregiver meetings where we ask them questions. That's what I'm thinking with this one. Because in that we would specifically say, how is your care today? And do you have the resources? And what would you recommend to make your home health service better for the Alzheimer's and dementia? Or caregiver, what would make your life easier?
Does this include primary care and hospitals as well?
It would include those as well. Yeah. Yep. The next one is then improving quality of services for everyone. And I think B and C go together. B and C are kind of the same. Once you obtain your information, see, our problem is we don't know the care today. We can't articulate, hey, home health has certified nurse aides, which I don't believe they do, but they have aides trained in dementia, and they go out and they have a 2-hour dementia training, but they don't really have an articulation of what that program in working with an Alzheimer's resident is. And maybe
So
then go ahead.
I view those two things different. So the bottom of the first page says improving quality of healthcare systems in servicing. I think there's word missing. So I think of that as the healthcare systems that we have in Ohio. Let's say Ohio Health, for example. They have a geriatric assessment center. What other healthcare systems in Ohio have that as part of their healthcare system? And then I view the top of the second page, improving services provided in the home and community to decrease the need for institutional care. Those are the things like home delivered meals, kind of case management sorts of services, caregiver support, things that are leading up to, it's sort of like what's in the Department of Aging Strategic Action Plan on Aging, the things that are leading up to need for, higher levels of care services that you may end up going into a facility or nursing home, like assisted living or nursing home. So I think that's how I view that second.
I love what you're saying. You just educated me. I agree. We could.
But Bev, a lot of this is stuff that ODM and ODA's already looked at. And so if they don't have policies, I'm pretty sure they probably have policies, even more sure that they have papers that they've put together about what they want to think, what they want to do when they look at these various issues.
Yeah, so I mean, we have the action steps in the SAPA, but I don't know that it's built out. I mean, that's the idea of the SAPA and the budget proposal of strategic initiative funding, is to then kind of flesh out those ideas of we need to identify the services that are necessary to prevent institutionalization as long as possible. So what are the actual steps? Maybe this group could help.
And I was on SAPA as well. But
yeah,
the underlying issue is whether I just feel like we're missing a step with the experts coming in and talking to us, and then us tweaking what the experts are suggesting, rather than us coming up with some sort of playbook before we've talked to people in the community.
I feel as if, Bev, I love what you said. I didn't even think of the associations and the systems in which they function. And I agree with you that that delineates it out so much better from the services. Having said that, I feel as if we're being looked at as the experts. I feel like that we're being looked at as the ones that should be able to answer the questions. And so I'd hate to wait. But then, Beverly, when I hear you talk about that, and Doug, you also have a lot of knowledge about groups and proposed legislation that didn't go through and committees that worked on some of these. Is it possible that the two of you could obtain that information for us? Or if studies have already been done, is it possible for us to have those? I personally couldn't articulate what the government or what Ohio has done already, but if they have some information, or that would be great. But I wouldn't be the one to reach out to them because I wouldn't know who to reach out to.
Well, Tessie may have an idea about this. I haven't been in that space for a long, long time. And, you know, when I was in Florida and worked at the University of Central Florida, I was working with people to look at things like that on a daily basis. You know, clearly Applebaum will have an opinion on everything that we have here, and he'll have a great suggestion on everything we have here. Harvey Stearns from the University of Akron would have a great idea about everything we have here. Susie Kunkel at Scripps would have a great idea about everything we have here. I'm just not that guy. And yeah, I can talk to you about home community-based services, even talk to you about quality in home community-based services and how you measure it. But even that doesn't necessarily have a focus on Alzheimer's. Quite frankly, home community-based services and Alzheimer's depends heavily upon a family member that's willing to take care of the loved one. And it just seems to me that these tasks are hard to break down to make them manageable without somebody that's willing to do research. Extensive research to answer these questions.
One other thing, the conversation talking about what is already existing also reminds me of our meeting last Monday, when I think it was Sally with the capacity committee. She was doing her report. And she's talking about how they are looking to obtain all of this information that we were just discussing from other agencies within the state, and who's got what position paper, and previous task forces or groups of various types that might have been instituted to look at some of these, if not all of these issues. So I wonder whether we have some further connection there. She seemed very interested when Catherine was going through the speakers, right, Catherine, that we had heard the previous week. She was totally engaged and was interested in looking at whatever information we could give her, notes from that, the recording of our session, etc. So I wonder if there's a connection there that we can capitalize on.
Yeah, there actually is, and that's a really good point, Diane, because if you look at the topics that are laid out on our, there are actually a handful that are just in our column. Mm-hmm. And those handful, I was actually looking back at the bios when we all introduced ourselves. And I took notes on all your bios. I think every one of you brings personal experience to this committee in a way that can really help inform the specific topics on which we are the sole responsible group. And so, for example, we are the sole group looking at improving the healthcare received by individuals diagnosed with Alzheimer's and disease or related dementias. We're the only one looking at that, and it doesn't speak to a location. Also, improving the quality of the healthcare system. We're the only group looking at that. And improving services provided in the home and community-based area to delay and decrease the need for institutionalized care. That's us alone. And improving long-term care for those, and including assisted living for those with Alzheimer's and related dementia. That is just us. And in each of those areas, it's not speaking to the framework of the specific quality measures, et cetera, but it's about how are we getting to the experience of individuals. And so I think about this for that individual at home who's receiving care in the home. And I remember the dementia bill that Representative Arndt was working on. And one of the challenges that we had with that bill is that the individual who comes into your home, that agency might also be providing childcare. And so making sure, how do you have every individual in that home care agency trained for dementia? The home care agencies were reacting with, oh my gosh, we can't guarantee that the individual who's going into a home with dementia has received, we can't guarantee that every one of our caregivers has that kind of education. So that then I think about us saying, wait, we need to come up with a system so we can make sure that every individual walking into the home is trained, at least to some degree, to be able to know, maybe, I'm not the person who should be in this home because what I'm seeing right now, I know enough to know that there needs to be somebody with advanced training within my agency. So I'm rambling, but what I'm trying to suggest is that when you think about the areas in which we're to be responsible, it is totally focused on the expertise that is brought by those of you who've had firsthand caregiving experience. So maybe rather than getting sort of bogged down in some of the elements that are being addressed by other of the committees, we can focus on those that are very, very specific to this committee alone.
So Catherine, I'm intrigued with that because following that path makes this much easier. And it doesn't seem so overwhelming with some of these when we think of what we do know. Just think about what each and every one of us know today. And what would we do differently? What is the need today? Maybe that's part of our experience through this. Maybe that gives us some really good answers and some really good choices to select and move forward with.
Catherine, I'm looking at these, you're looking at the AMSB 24 topics. Is that what you're looking at?
Yeah, the
And
ones which are alone.
Which ones were, so clearly there's 2 pages and I don't know what the difference is, but clearly number 20 is one that we have by ourselves. Is that correct?
Yeah, 15, 16, 20, 21.
So I must be looking at the wrong thing.
Actually, it looks to me, in my version, it looks like 15, 16 are shared with science. Is that what you're seeing, Doug?
Yeah, that's
Yeah.
the version I have too. I don't know if I've got an older one.
Yeah. So it looks like 18 is ours alone.
And 20.
And 20 is ours alone.
Yeah.
Wow.
And actually, that's all I see.
And I don't have a date on my document, so I can't
Yeah.
see. Oh, well, I'm not sure I helped anything at all.
All right. So let's
You
just.
you didn't hurt.
No, definitely.
No, this is good that we're trying to figure it out. So I have a couple ideas. What if we set these, we 100% decide how do we set up these calls and this information gathering from the providers that we're trying to change. And we take that information to help us through. And what if we took diets to do the calls? And I myself with Tessie or Melissa with an online survey, we can set up scheduled meetings with the home health providers, couple first responders, caregivers, and then each of us will, after our call, say, this is what I learned. And then I can absolutely come up with just a format that incorporates our objectives as part of the questions and a learning experience. What if that's how we focused our groups right now? Would that be an agreement or another idea?
I'm a frustrated academic, and I was, when I worked for the state, I helped save ONECA, which later became OH. And I always think that good policy comes from good research, and I always tend to go to the universities first, and then to the providers second. But that doesn't mean that your way of thinking about it is the right one. That's just a different way to think.
Hey,
If I could say something, this is Melissa. I like what everybody has said so far. I guess I feel like we need kind of a two different approach because we have to gather that information from the professionals, but we also need to start gathering the information from our citizens who are experiencing this. Because how can we even say what needs to be improved if we don't have that data from people who are living and breathing it every single day to help guide us in the questions that we ask the professionals and to ultimately make our recommendations? So, I mean, I kind of think, my proposal would be, I'm happy to do that survey and I can get it put together by the end of the week. And if people can send me ideas or questions that they would like, but the survey would be very focused on our citizens and how we push it out. I don't know. We can send it to friends or family that we have. Perhaps they can post it on our task force website and just encourage people to reply. The way I started working on it, the way I kind of started to break it down was by how many years a particular person has been battling this or their caretaker, and then going from that step based on our conversations today of what type of services are they receiving, home health, assisted living, or in the specialized memory care, and breaking down the questions that way. I don't know, we could only get 5 people to reply, but I feel like each of us have probably at least 5 people we could send the survey link to once it is finalized, and at least start somewhere.
And I think we could tap into the Alzheimer's Association with those folks they know, the ones that they offer support to, the ones that they're doing the care plan conferences with. And we could get a group of families, we could get a group of perhaps even some individuals in early stage dementia and Alzheimer's to be a group as well. So here's what we can do. Melissa, we'll send Melissa our ideas of questions, right? Of what and it can't be a ton. They would have to be relative to our objectives. I can come up with a format for added groups, such as the skilled nursing providers, the nurses, the first responders this week, and with some help, we'll set up those meetings maybe for like the 3rd week or 4th week in May. And then maybe today our objective is that by the 1st of June or the first week or second week of June, we will have that research and that information to make some educated decisions. And from that, from these surveys and from these discussions, we're going to learn more about where we have to go to the expert, where we're going to have to go to find these out. But also, Doug, from, like you said, Bob could probably answer all these, and maybe we do send him a list and say, could you please, if you have information relating to this, this, and this, perhaps that could be forwarded to us. Or we could have him speak to us again. We could have another call with him that is more specific about this. But we could also break down some of what they all said. I mean, I think we already know today we need better training. We already know that. We already know that women have a higher demand for the need of Alzheimer's care. And that diversity is a big deal. And so we have to figure out how to reach every community and every citizen in the best way possible. And we already know that from our education, from our speakers. So.
Well, Catherine and I were on a committee, what was it, last year, Catherine? Or the year before? Not that it makes any difference. Alanda's committee, and it talked about Alzheimer's, and it talked about Alzheimer's training. And the goal was to try to get as many people trained as possible. And I really don't know whatever became of that, because I don't think it went forward very far. But, we're going to have to do something.
Yeah, and I don't want us to just always hang up from this committee call without a clear objective of propelling us forward. I think last week was great, or our last call, because it did propel us with information. But now we're kind of stuck in but we need more.
So let me try to come at it a slightly different way. So after listening to Mr. Van Vlymen, I think everyone would agree that there has to be screening and by docs. That example of Lake Health System was really a powerful one, that less than 1% of those over the age of 65 was screened. And so that one fact opens up a series of questions. How like do we reach out to a physicians association? I don't even know what they all are. How can we work to ensure that there is screening? What is their impact? A totally different group than we've had discussions with before. Ohio Hospital Association, if there's an admission of anyone over the age of find your age, that includes every hospital admission would include a high level screening by the discharge planner. So we talked to the Ohio Hospital Association. I mean, all sorts of questions emerged for me from that one factoid, how would you go forward? So rather than looking at the Subbill 24 topics in a sort of narrow way, can we step back and look at the presentations that we've had and say, what are the questions that we would want to have answered about how can we address some of those serious voids that we saw in that presentation through the work of this experienced committee. So it's a different than being constrained by the topics, but rather what we now know, where should we go with our work?
And Catherine, some of that is funding limited.
Yes.
I will tell you that we had a substantial Alzheimer's disease initiative when I worked at the state in Florida. And the first thing that was given to anybody that they suspected had Alzheimer's or were starting to have Alzheimer's was the mini mental exam. And so there were steps that were put in place to go ahead and try to start the process as quickly as possible. We don't do that in Ohio, and I don't know why.
So I know that, and I know all the neurological testing, right? The clock, the put the hands on it. I'm going to say 3 words to you, and then I want you to repeat those back to me 20 minutes later. But I read that Ohio State has an online assessment for Alzheimer's and dementia that families can give or take or give to their loved ones. Perhaps that's something we should reach out to. Perhaps we should reach out to Ohio State and take a closer look at that document. And I think I printed it off once. It's very comprehensive, yet it's available as a at-home assessment even. I'm just, perhaps that's another area that is, if we educate the public to, there is a way to make an immediate assessment that would prompt you to go to your provider to have an official assessment, because there's a lot of families that don't know if this is just normal forgetfulness or is it Alzheimer's. And I can even tell you with myself and my mom, after years of working in memory cares and owning them, I wanted to deny she had it. I didn't want to believe that my mom had Alzheimer's, and I attributed her silliness in the beginning to so many other things. And I think there's a lot of families out there feeling that way. I don't want to believe that this is a diagnosis that we all have to deal with. I read something yesterday, and perhaps some of you did too. I think it was somewhere on social media where it said, when someone is diagnosed with Alzheimer's, it's a diagnosis for 2 people, the person with it and the loved one. And so that's just a huge issue, is denial and the aspect of what do I do now? And if as a committee we can answer some of those very heartfelt questions, then we've done a great job, So moving forward, should we proceed with coming up with our questions, submitting to Melissa, having Melissa create an online survey, coming up with our meetings of who those providers are that we must talk to, and I can certainly send out a list, and then you can add and delete, and then we can talk about that, and then arranging for those. I could also reach out to Ohio State and ask them more about that assessment, or I'll find it and I'll send it to all of you for you to look at as well. Go ahead. Oh, okay. So we're late to the game, huh? Is it? Okay. Yeah. Yep. And because we've all had an experience, maybe we should all submit to each other, what would you like to see differently? What would have helped me or you? What would help you today? If only this was happening, if only I had that. And I think maybe we should all do that as well. But that's
Okay. So just a quick question about the survey that Melissa's working on. Once again, I want to make sure I understand who the audience for the survey is. So it's individuals who have been diagnosed with Alzheimer's or dementia, and it's caregivers?
Yeah, I mean, I could tell you, like, from my personal experience, my mom would not be able to take a survey. I mean, she's been, experiencing this for 3 years. Now, right after she got her diagnosis, she did. And I kind of have it, and I'll send it out right after we get off the meeting. I have it broken up by like 0 to 3 years, 4 to 6, and 6+. But I think primarily the people that would reply will be the caretakers.
Yeah.
But
That's
I think
pretty much what I thought. But
yeah, I don't think we should exclude those that, maybe are in their first one.
Their early stage.
Mm-hmm.
Yeah.
Or, especially as we talk about like those, that need to do the like little tests when you're going in for your yearly physicals, like we were just talking about, making sure that.
Yeah. I agree with that. Right now, every physician, you've all probably noticed when you go for a physical or you go to your doctor, they go through the safety check. Do you feel safe at home? Do you, I can't remember those questions, but they ask everybody that. Maybe there's 4 questions that are asked to people 50 and older, 55 and older, 60 and older. Dementia and Alzheimer's starts decades before the first symptom, which is scary. Maybe we set that age. Maybe it is 50 and older, just to get an early thought. I don't know, just an idea. But yes, these are all the good discussions, I believe. That's helping us move forward.
Pam, are we just looking to ask questions for people that are currently living with dementia, or are we also looking at people like myself whose mom has passed and could answer those questions instead of currently, but in the past, did you experience
No, to families too. To families. And even for this committee, and Tessie, maybe we do ask everyone, what are your personal experiences and what would have helped you? That's monumental. And I think that's why we're here, right? I have many, many ideas about what would have made it better. But then maybe that's just my personal experience. But when you see the same thing coming up many times, now you know that's something that has to get changed. So Tessie, maybe we can send out questions to the whole group. Yeah, I think separate. And for Melissa, let's just send her a couple ideas. But then Melissa, I don't know what number of questions you're thinking. Is it 6? Is it 10? Is it 15? What?
Yeah, like less than 5 minutes to take the survey.
Yeah. Yes.
But multiple choice goes pretty fast. So I think 20, even. And maybe like if someone's in 0 to 3, the survey will only be, 2 minutes long. But if someone is 6+ years caretaking, then maybe it'll be a little bit longer because we'll have more questions.
We would say, is your mom early stage, mid stage, late stage?
Mm-hmm.
Yeah. Okay. So let's everyone send a question or 2 to Melissa. Melissa, then you'll have to let us know what makes sense, or you might get all of us asking you the same ones. I will do the formulation of the provider groups, and I'll get that out to everyone. And if I miss someone or you think someone should be on it, then we'll add them to it. I'll get with Tessie. Somehow we're going to figure out how to set up some meetings with some people, but I'll look at the Ohio Hospital Association. And if anyone else has ideas on other organizations that would be great to reach out to, please send that information.
I think you want to reach out to the physician groups as well. My oldest son's a 5th-year surgical resident, and I talked to him about what he learned about long-term care in his college courses, and he didn't learn anything. And I'm on the Neomed board of directors, and we don't talk about it very much there either. So it seems to me that, particularly looking at the numbers that Applebaum presented up until 2040, it's something that we should consider very, very seriously.
Is there an association of medical schools? Huh. Oh, that's right. You've got great background for us there, Tessie.
Okay.
And then do I remember that there's one final step, and that Pam, you're going to work with Tessie on a survey for the task force?
Yes.
So Catherine, are you going to put all this into a succinct document?
I'm going to try. That's what I'm trying to figure out. I think
Then we'll be more confused.
So I know what I promised.
We walked away from the dyads approach. Is that correct?
Yeah, we said no.
All right.
All right. Does this sound like a plan? So we're going to exchange emails, thoughts, ideas, but we know our objectives are the surveys, the questions.
And I'm going to try to get this meeting summary out within 24 hours, because if it's wrong, I think we all need to make sure that we're on the same page, okay?
I'm quite sure it won't be wrong. I just don't know that I'll remember it right.
Oh,
I like that parsing.
so in August, we'll all be proud of ourselves, right? When we're all done. And
that was what was so disappointing about Palana's task force, is that we worked on that pretty hard for quite a while, and I thought it really had some legs, and at the end of the day it didn't. So it doesn't mean that we should feel badly in any way, but certainly give our best effort.
Okay. Anything else? All right. Well, flurries of emails will be coming.
Very good.
All right.
Thank you all.
Thank
Thanks.
you, Tessie.
Thank you. Bye-bye.
Right?